This is such a problem for so many people. Hundreds of thousands of Americans tear the ACL in their knees every year, and many undergo ACL reconstruction.
But there may be a more natural and less painful way to fix it. WBZ's Dr. Malika Marshall shows us the new treatment which could help patients avoid traditional surgery.
Tori Waldstein was hitting the slopes with friends a few years ago when she went tumbling over a bump.
My ski didn't pop off, so my knee sort of twisted around, and I knew pretty quickly something bad had happened.
The 30-year-old had suffered a tear of her ACL, a ligament that connects the thigh bone to the shin bone and helps stabilize the knee joint.
They happen pretty frequently, particularly in patients who are very active, like Tori. Typically in pivoting cutting sports like soccer, basketball, football, and skiing.
Dr. Mithoefer is an orthopedic surgeon at New England Baptist Hospital. He says most patients who need surgery undergo a traditional reconstruction, where the torn ligament is replaced with a tendon removed from another part of the body, like the quadriceps or hamstring muscles. But that can lead to chronic pain and weakness in those areas.
You're robbing Peter to pay Paul.
But a new procedure called Bridge-Enhanced ACL Restoration, or BEAR, avoids that.
What the technology does, it actually helps to biologically heal the body to heal itself.
This collagen implant is first saturated with the patient's own blood to provide growth factors to aid in healing, and is then placed between the stump ends of the torn ligament. Compared to a traditional ACL reconstruction, patients who undergo the BEAR procedure spend less time in the OR, have fewer incisions, less post-op pain, and are up and about much faster.
It's also a more natural biologic restoration of the joint anatomy, joint function, which I think restores function and ability to return to activities more naturally.
Tori chose the BEAR procedure over traditional surgery and is happy with the results.
I'm back to doing pretty much everything I was doing before.
She was back on the ski slopes the very next season. Dr. Malika Marshall, WBZ News.